My name is Cort McCaughey. I'm a dermatologist at the Budge Clinic with Intermountain. So I'm originally from this area. I left when I was 17. I went to college in Wisconsin and played college soccer there for 4 years. Then I spent some time back here for medical school, but then went back to Wisconsin to do my specialty training in dermatology, and fortunate enough to come back and be near my family now. I knew I wanted to do medicine fairly early on in college. I had spent a fair amount of time in physicians' offices for various things, sports injuries, and I'd seen dermatologists, and there were times where I'd go in and I felt that all my questions weren't answered. I knew that I wanted to be different. I knew that I could, I could change that, and I could be a good physician, and that's when I decided. So my goal is to make sure that patients get all of their questions answered during their visit, and that they understand various treatment options, and that they have some role in deciding how they want to treat their skin condition. Oftentimes people come in with benign conditions, but we end up finding things that can be malignant, or can mean that something's going on internally, and it's real rewarding to be able to catch those things early for patients. So for atypical moles, we often talk about the ABCDEs of melanoma. A stands for asymmetry, B for irregular borders, spots that are sort of lumpy and bumpy and have jagged edges. Color meaning that there's various colors within a spot on the skin. Anything more than two differing colors can be concerning. D for diameter, if a mole is greater than the diameter of a pencil eraser, that can sometimes be concerning. And E stands for evolving, meaning that you've had a spot there and now it's changing. And those are some helpful tools to use at home for patients to help them know when is it time to go see a dermatologist. I would say the best days for me are when patients come in and they've had something on their skin, or a rash, and they haven't had an answer or an appropriate treatment for that condition for months or years, and they come in and we're able to answer that question and treat them and get them better, and that's real rewarding for me.